Our next speaker will be Professor Jean Macq, who is a medical doctor with a diploma in tropical medicine, a master in public health, and a PhD in public health. He is professor at the Faculty of Public Health at the Université Catholique de Louvain since 2008, teaching healthcare services organization, system thinking in public health, healthcare system coordination, and networks organization. He's also a senior researcher at the Institut de Recherche Santé et Société since 2008, coordinating research and evaluation projects in the fields of integrated care, inter-organizational network analysis, chronic care, and primary care organization. He has developed competencies in the application of complexity and system thinking methods in evaluation, including dynamic modeling, such as agent-based modeling and causal loop diagrams. Please welcome Professor Jean Macq to the stage.
Good afternoon, all of you. I'm proud to be here because it's very nice. It's a very nice place, and very happy to be invited by this, I think, very nice global health master. I decided to push it here. You see, I'm even super. So first of all, Professor Christine Mikkelsen did a very nice introduction of what I will speak about. So I think I will have to be a bit adaptive to not repeat just what he said now, and I will directly focus on something that may help you to understand better what is system thinking all about. What I would like to talk about with you is a new project I've just started now with colleagues from several countries in Europe. And this project is about de-prescribing. De-prescribing meaning stopping prescription. It links with the concept of de-implementation. That is, the purpose is not always trying to implement new innovations, but it may be, and it is useful probably, to stop implementing some of the things we have been doing. And the nice things of this project, as you will see, is that it confronts those people, as said Christine, that has a very analytical focus with other people like me, who takes a likely different focus on how to look at the situation, how to look at a problem. So the why system thinking, this I will avoid to repeat because just Christine told you that aspect. Maybe just something nice to me is that woman that is called, I think, Rosalind Eben. I invite you to look at on internet on her. She's comparing what you will see substantialism with relationism. It says to be also a bit with analytical approach and more system thinking. And it's a woman even older than me, who has been working, I think, for years and years for the FID. So I remove all those things because you have heard that, except that I think in the analytical approach, something that is always very important and that make it appealing, it helps to manage the issue of accountability, particularly when we believe that accountability can be ensured through control. I go to my project. Okay. So a project to de-prescribe benzodiazepine with 6 countries in Europe, Spain, Greece, Poland, Belgium, Switzerland, and Norway. So actually quite different countries with people with actually in Europe quite different culture. Some of the people think we will test an intervention. And what we want to do in the classical experimental approach to compare those people who receive the interventions to those people who will not receive the intervention. As you can see, the intervention is already something quite messy, isn't it? There is a lot of things that are mixed up and that are coming one behind the other. The logic of the analytical approach would be to say, okay, what we will do, hope it doesn't appear as I would dream it to appear, is that we will cut the intervention into pieces. So we will make it a different group of activities. And what we are very much used to do in the European way, we are promoting the hyper-specialization. And what we will do, therefore, is to ask a specialist of each of the group of activities to deal with one activity. So here, for instance, the issue is to prepare guidelines. Here, the issue is to develop behavioral cognitive therapy. Here, the issue is to deal with shared decision making. So you have different work package where each of them prepare, design part of the intervention that will be tested. And of course, to implement the intervention, because this is an implementation trial, to implement the intervention, we have different agents. And each of the agents, the idea is that if the behavior of this agent change, as a result, the prescription will be a success. So the interventions aims at influencing different type of agents. Here you have the physicians, there you have the patients, there you have other type of healthcare providers, and here you have secret agents. So the agent we don't talk at all in this project, but to me that could be of importance, like for instance, pharmaceutical company, but also for instance the manager of the hospital when you would try the implementation, because manager of hospitals, what they aim for is to be ensured that they have enough money for their hospital to function. In that first logic, we cut the intervention into pieces. We cut the world into different agents that are not connected one to the others, of course. And actually, what we have in mind is one intervention, the one I just explained you, to influence the behavior change of some actors, and finally to improve the health. So we are in a very sort of linear approach where, of course, some of the people will benefit from the interventions, others will not benefit from the intervention. I could apply the same logic to, I don't know if it's in your country something important, but like in Belgium now, integrated care is like a buzzword. Everybody speaks about integrated care in the world of healthcare organization. And when you ask to the people what it means everything and nothing, actually. It means series of things, and it goes in all directions. The same with PBF. You can interpret that in many different ways. And the same with COVID, I think, also it gives problems. So people have applied the same logic that I've just explained you to integrated care, to PBF evaluation, but also to some intervention related to COVID, and trying to cut it in piece and with different agents. But of course, the logic that I just explained you probably do not work, because there is actually interconnected worlds. I thought I wrote worlds. One, and two, because of blurred or sometimes conflicting outcomes. Minus interventions to de-implement, to de-prescribe. Actually, when we discuss a bit more with the various countries, what really comes at stake is who will implement it, but from which setting are they coming? It can be from hospital setting or from primary care setting. And actually, we were just discussing this week with people from Norway, Spain, Switzerland, all those countries. When you ask people what is primary care in your country, you get very, very different views For some, primary care is just the action that is done by an internal medicine doctor. For others, primary care is something that is done by multidisciplinary teams. So you get different worlds, and actually the idea is, in that issue, the different group of activities, as I explained you, that are part of my interventions, in my new logic, what they will do, they will help me to better understand actually these different worlds that are interconnected. So the purpose here is not to test an intervention, but through my intervention, I will better understand the interconnections, for instance, in my case, between hospitals and what could be primary care. The same example, this is an article from the Lancet that explain the syndemic approach that connect, you know, syndemic approach. Syndemic approach is the connection between different epidemics, but that connects actually malnutrition problem with management of the environment and those things. I go a bit faster. So interconnected world, and by intervening, I better understand the interconnected world. Second things, actually, the different agents, if we ask them their view, in our case, I go back to my intervention on deprescription. If you ask them their views on what could be the purpose of that intervention, you get actually different views. And the views are not necessarily the same. So sometimes they are conflicting views, or sometimes they complement each other's. In that sense, having the perspective of different agents will help me to clarify where I want to go, or at least to clarify the contradictions between different perspectives. And as a result, my interventions becomes a means to make explicit the different views of a given situation. My given situation is really a healthcare organization when you have hospitals walled with primary care walls that are interacting one with the others, with outcomes that could be helping people to sleep better or helping series of other things. The second logic that I just explained you, or try to explain you, well, the nice woman, Rosalind Eben, called that relationism. And the relationism is indeed, you look at the world as the interactions between entities. I do not do what Christine was really well explaining in terms of analytical approach. And the purpose in this approach is, thanks to the interventions, I will better understand a situation. But the situation I will not understand, you see already that I take different way of approaching that same situation. So I could almost say I don't bother of the intervention. What I bother is a situation. And in my project, European project, I have finally 6 different situations that will help me to and the intervention will help me to understand these six different situations, and hopefully to find commonalities, to find regularities between these different situations. So, having said that, what is system thinking? I think you have understood. This is not system thinking. The issue here is to really test the effectiveness of an intervention, and to make it short, on system thinking, what is the purpose is actually to feed governance and to feed a certain way of governance in such a way that it helps the governance and the decision making to adapt to a given situation. And now I hope I still have some time. And then if I go more in depth, what is really vital or what is really important to me when we speak about system thinking is actually a way to look at the world. A system is not something that you can take in your hand. A system this is the glasses I put it here. This is a system that helps me to look at the world, to look at a situation. And particularly what I'm trying to look at is using the complex adaptive system lens, where you have key characteristics that are path dependency, said it very quickly, the pathway that things takes to take me till I am where I am now. Sorry for my English, now that gets mixed. namely the history of my situation. 2, the causal loop issue. We are not interested only in trying to isolate cause from its effect, but we are very much interested in identify causal loop. And 4 and 3, the issues of networks, but not very homogeneous networks, but the way some particular networks that are of interest to understand. That these are characteristics that will explain key behavior. The key behavior would be emerging something, totally unexpected things. And of course, what's happening now, particularly in Europe, it's something emerging that you could analyze in a certain way. And also the tipping point or transition phase, you pass from one equilibrium to another equilibrium, and you can not always predict when this will occur, actually. So you try to characterize your system to identify key behavior. Something very important also in system thinking is that you are used to use in the same time the microscope and in the same time the telescope. Let's put it like that, and trying to look at the things in the very micro and a very macro way. So I could look at each of you individually, or I could look at the whole as you are. And then finally, something very important is to take different sources of information, and one of them being the tacit knowledge, the knowledge that we have all of us about a given situation. Sorry. But no, this is contra-intuitive. The intuition for me when I push here, I think I will go up and then okay. So now, how could we start system thinking? And this is about a MOOC that is existing in French actually, that is on edX, which is on platform, and that I'm using to teach. The idea is that you can take different type of starting point to develop system thinking. A first starting point is very inductive. The idea is that you have a situation that you look at as a system and you have different view. You mixed the tacit experiential knowledge of different person, but also you have to manage what we call the cognitive bias. I don't know if you heard about that, but cognitive bias, this sort of short circuits in your minds that sometimes makes you taking wrong decisions. But you can also start in a very deductive approach by looking at different theories that helps you to understand the same situation. The issue is from this inductive or deductive approach, the idea is that you need to start a sort of reflection process that can be either very participative. I put around the table people and I try to help them to share between them their own tacit knowledge, or I confront theories with realities. And something that is very key to me when you work in a system thinking approach is to use model, that is simplification, simplified representation of a situation. And you try to use the model to connect the reality with a theory and with different type of theory. And what you try as much as possible is to use different way of modeling. The first of it, to me, this is modeling, is the storytelling. So telling a story is a way of simplifying a situation. And the approach that we follow in that MOOC is first, we start with a story, and we try with that story to identify, to make a delimitation of a system. So you get a model that is just a drawing where the people say, okay, this is my system, and I have series of agents, and I have series of activities that take place within my system. The second step is, okay, we will do things that are very intuitive for people, is building theory of change, but a theory of change in the way I teach system thinking is very much based on actions, because people are very used to link actions with outcomes, a bit like I explained you with my project. then they get to, this is messy something, but to a link between a series of actions and given outcome. I try to speak more there. Then the third step would be to use other forms of modeling to question the way I've designed my theory of change. And the idea to model is, of course, not to predict, but is to come with a collective, hopefully, learning about a situation where you have the conception of the model, and when it's possible, you can use the dynamic, the evolution of the model to try to think about or to try to learn together about a situation. So the type of model is agent-based modeling. I've tried for years to connect that with my world. It's very difficult, actually. I'm not succeeding always. Well, you were doing it, but it's not easy, actually, for people to connect one with the others. Actually, I think you may use two types of model. This type of agent-based modeling, where you really simulate a situation and you simulate a dynamic change based on rules that you give, to agents and the interactions between these agents. Another way, but it is different, is much more static, is to develop actually networks and to clarify the interaction between those different agents. But here, you cannot make it moving. You cannot give dynamics to it. But I think it's very interesting and much more easy, I think, for people to understand the meaning than this type of something that looks very mathematical. So that was actually the micro approach when you look at agent. The more macro approach, then you would look at the system as a whole. This is another way to look at the same situation, another way of modeling. And what you look at there is two possibilities. Again, either you have what is called stock and flow diagrams. When you try really to create some form of dynamic, you simulate change within your systems. But it is, again, very uneasy to communicate this type of things with other people, almost finished. Or the more easy way to approach this is to use causal loop diagrams, and I think I understand you have learned to do that, you have done that, which is static, it's not moving, you can not know what's happening, but I think it's much more intuitive for us to do this type of things. So I think I come to the end. Probably you know these type of things, but I come to the end. My purpose finally was to try to explain you, or to apply as much as possible system thinking to a given project, my European project I'm just starting now, and to try to explain you in very short way the different steps that actually I'm used to develop when I'm trying to develop system thinking approach applied to healthcare organization, but it could be to global health, of course. Thank you very much.
Thank you, Jean Macq, Professor Jean Macq, for this very interesting speech. I think you